Bismillah ar-Rahman ar-Rahim. This is the last session, but not the least. Professor Dr. Naser Saeed will talk about gluteal hemangioma. تفضل Dr. Naser.
Thank you, Mr. Chairman. Good afternoon. My presentation actually about gluteal arteriovenous malformations, high flow arteriovenous connections. My challenging scenario about young chap, 32 years old, presented to us, to our center, with a bleeding, or we can say massive bleed, vascular malformation at the left buttocks and the thigh, which need tight compression for a long time to stop it. And actually the bleeding recurred several times before he coming to us. This young chap had a several time injection sclerotherapy with alcohol and the foam sclerotherapy without any success to stop the bleeding. This is left gluteal with two bleeder points, and the CT showing massive an arteriovenous malformation. So the decision, it was quite difficult to complete the ethanol injection and the foam sclerotherapy in spite his bleeder still bleeding, and so we decided to quickly try to do sclerotization of the iliofemoral arterial segment on stages. And as you know, sclerotization does mean complete dissection of the artery from its surrounding tissue to make sure you are ligating all the feeder or structure connected to this horrible malformation. First one, we done sclerotization for the left iliac artery segment and ligating the left internal iliac artery. And this young chap, we are not so worried about benign dysfunction because trial proved one internal iliac may be more than enough. Second stage, couple of weeks later, we decided to skeletalize the common femoral segment with ligation of the main one big branch from the profunda. By using a Doppler, proved it is connected with the malformations. Post-operatively, actually, as you see, this is the arrow show you the ligated left internal iliac artery, and it does make great help as regards to reduction the size of the malformations. And honestly, the patient post-operatively assures that he get great benefit as regards to the previous tension in the gluteal region. I just forget to tell you, this young chap stayed for a long time, cannot sit down or lie on spine. He used to lie on his right side and cannot sit down for even for a short time. We done a post-operative CT actually show no great benefit from the radiological point of view, but clinically the patient felt great benefit as regard to the decreased tension. The good news that there is no more bleeding from the both sides, especially after decreased tension inside. You can see, next slide, you can see this blue two arrow showing the lecture of the left internal iliac and the profound branches. Here we are. You can see, you can realize that the tension inside the lesion decreased with no bleeding. And this is the last recent photo for the patient. So our current plan now, what we should do next, there is still connections in the lateral side, just above the neck. I think we now, after decrease the tension, and we can start to do local sclerotherapy, whatever with ethanol or with foam injection. We start with polydecanol because it is easy to do it and repeat it without anesthesia. And as you see, the butterfly needle I inserted away from the lesion just to avoid any bleeding from this malformation anymore. Also, you can see that the swelling refilling is slowly, not like before. It was under tension and it was quite difficult to compress it. I will repeat it again. When you press and release, it wasn't like that before, actually. Anyhow, our conclusion, new strategies that fully integrate traditional surgical therapy with combination of embolization and surgery are effective in lesions which once would have been impossible to treat. This system of treatment aims to improve the quality of life from this ever miserable disease. I just would like to make things clear. I know skeletalization is an old operation, but the situation in which patient coming with bleeding, massive bleeding, need long time to stop it, and the situation wasn't, we don't have the luxury to start sclerotherapy, so we decided to do skeletalization and see how things going. Fortunately, bleeding stopped, and we will complete the sclerotherapy, and I will let you know about the result in the next conference, hopefully. Thank you very much.